Welcome to the deep dive. Today, we're putting a spotlight on something that might be quietly affecting our dogs and cats. Systemic hypertension.
Yeah, simply put, we're talking about persistently high blood pressure in our pets.
Hmm.
And what's really key to understand right from the start is that this isn't usually a standalone problem.
Okay.
It's often a red flag, signaling that something else is going on within their bodies.
Exactly. You've compiled a fantastic set of resources on this, and our mission today is to, extract the most important insights for you.
Mm-hmm.
We want to give you a clear picture of what systemic hypertension is in our furry friends, the reasons behind it, what signs you should be aware of, and how vets diagnose and manage it, all without getting lost in the medical weeds.
Right. Cut to the chase.
Ready to dive in?
Mm.
Okay, let's start by defining what we actually mean by high blood pressure in pets.
Okay, so in both dogs and cats, if we consistently see a systolic blood pressure that's the top number, the pressure when the heart contracts above 160 millimeters of mercury, or mmHg, or diastolic blood pressure, the bottom number, when the heart relaxes above 120 mmHg, that's generally considered abnormal.
Okay, 160 over 120 as the sort of threshold.
Yeah, but it's really important to differentiate between, say, a single high reading, which can sometimes happen just from the stress of a vet visit. We often call this the white coat effect.
Right, like people get too.
Exactly. Differentiate that from truly sustained pathological hypertension that actually needs attention.
That makes perfect sense. And you mentioned primary versus secondary hypertension earlier. What's the core difference there?
Well, primary hypertension, sometimes it's called essential or idiopathic hypertension. That's when the high blood pressure just sort of develops on its own, and we can't really pinpoint an underlying cause.
Okay.
In vet medicine, we think this is relatively uncommon. The vast majority of hypertension cases we see in dogs and cats are secondary.
Meaning they happen because of something else.
Precisely. They occur as a consequence of another underlying health issue.
Okay, so the high blood pressure is usually a symptom pointing to something else. That leads us to the big question, the why. What's actually happening in their bodies to cause this sustained elevation?
So, at the most fundamental level, blood pressure comes down to two main things.
Mm-hmm.
How much blood the heart pumps out, that's cardiac output, and how much resistance the blood vessels offer to that blood flow, that's systemic vascular resistance.
Okay, output times resistance.
Yeah. And the body has these incredibly intricate systems involving the nervous system, the kidneys, the heart itself, and various hormones and other signaling molecules in the bloodstream. We call these humoral substances that constantly work to keep this balance in check.
Humoral substances?
Yeah.
Like what specifically?
Think of hormones like catecholamines, that's your adrenaline and noradrenaline,
Right.
vasopressin, and the whole renin-angiotensin-aldosterone system. You might hear it called RAAS.
Ah, okay.
And different medications we use can actually target specific points in this RAAS pathway. That's why, a multi-pronged approach to treatment is often needed.
Got it.
Now, while we don't fully grasp primary hypertension in pets, there's some evidence suggesting maybe a hereditary component in certain dog breeds.
Interesting that there might be a genetic link in some dogs. But our sources really emphasize secondary hypertension as the main concern, right?
Absolutely.
What are the most common underlying issues that drive it?
The most frequent links we see with secondary hypertension in both dogs and cats are chronic kidney disease and various endocrinopathies.
Endocrinopathies, diseases of the hormone glands, like Cushing's or hyperthyroidism.
Exactly. Hyperadrenocorticism, or Cushing's disease, is a significant factor, as is hyperthyroidism, especially in cats.
Mm-hmm.
Diabetes mellitus can also contribute, though maybe not quite as often as kidney disease or those other hormonal imbalances.
Okay.
Beyond those, things like IV fluid therapy, certain medications that cause blood vessels to constrict, steroid drugs, even erythropoietin therapy,
Yeah.
those can also lead to elevated blood pressure.
Wow. Okay.
And it's critical to remember that this sustained high pressure can, in turn, cause damage to vital organs. We call this target organ damage, or TOD.
Target organ damage, TOD.
Yeah. For instance, those changes we might see in the retina of the eye, they can be an early indicator of wider systemic vascular damage, which would then prompt us to investigate other organs too.
Target organ damage, that sounds really concerning. Which organs are most vulnerable here, and what kind of signs might a pet owner actually notice if this is happening?
The primary systems affected are, well, the cardiovascular system, the nervous system, the eyes, the ophthalmic system, and the kidneys and urinary tract, so the renal urologic system.
Okay.
And for each of these, there are specific clinical signs that can be quite telling.
Okay, give us some examples. What should we be looking out for? What might make us think, something isn't right, maybe we should get this checked?
Right. Regarding the eyes, sudden blindness is a really alarming sign, obviously.
Yeah, definitely.
Other ocular issues include bleeding within the eye, pupils that are dilated and maybe don't constrict properly in light, and various problems with the retina, like detachment or visible changes in the tiny blood vessels back there.
Okay, eye changes. What about neurologically?
Neurologically, you might observe your pet becoming unusually quiet or depressed, maybe developing a head tilt, experiencing seizures, showing nystagmus, those are the rapid involuntary eye movements,
Ah, yeah.
or having balance problems like wobbliness ataxia, or just seeming disoriented.
Those all sound like things that would definitely warrant a vet visit. What about the kidneys and the heart?
With the kidneys, especially if the hypertension is linked to underlying kidney disease, where we often see excess protein in the urine called proteinuria, which itself is a sign of kidney damage.
Okay.
You might notice increased thirst in urination, PUPD, sometimes call it. You could also see blood in the urine.
And cardiovascular signs.
Cardiovascular signs can include the vet picking up a new heart murmur, or maybe an irregular heart rhythm. In more severe cases, though it's less common, you might see an enlarged heart on x-rays, or even signs of congestive heart failure. And occasionally nosebleeds can happen too.
So, a pretty broad spectrum of potential signs affecting different parts of the body. Let's circle back to those root causes. We've touched on a few, but can we get a more detailed rundown? What might be driving this secondary hypertension?
Certainly. As we said, renal disease, kidney disease of all types is a major one.
Yeah.
Chronic interstitial nephritis, glomerulonephritis, amyloidosis, polycystic kidney disease, even developmental issues like renal dysplasia.
So, lots of kidney possibilities.
Yeah, a whole range. Then we have the endocrinopathies, hyperadrenocorticism, that's Cushing's,
Right.
hyperthyroidism, which is particularly common in cats, as we mentioned, and diabetes mellitus, although again generally considered a less frequent cause of the hypertension itself. Then there are less common culprits, like pheochromocytoma, that's a specific tumor of the adrenal gland hyperaldosteronism, and even certain diseases affecting the central nervous system. But the key takeaway, really, from the research is that pre-existing kidney disease or an endocrinopathy significantly increases the likelihood of a pet developing systemic hypertension.
That makes sense. So, if a pet is already managing one of those conditions, it sounds like regular blood pressure monitoring would be a really smart preventative or at least early detection measure.
Absolutely.
How exactly do veterinarians go about diagnosing hypertension then?
Well, a definitive diagnosis requires consistently documenting elevated blood pressure readings. We need proof it's sustained. And we use either direct or indirect measurement techniques.
Okay.
It's worth noting, routine blood pressure screening isn't necessarily recommended for every single animal walking through the door, but it's definitely indicated in pets with those known risk factors we talked about, or when clinical signs suggest a potential problem.
You mentioned direct and indirect methods. Can you explain the difference?
Sure. The direct or invasive method is kind of the gold standard for accuracy. This involves placing a catheter directly into an artery to measure the blood pressure in real time. While it gives the most precise measurements, it's generally not practical for routine outpatient use in awake animals. It's just too involved.
Yeah, sounds like it.
It's typically reserved for specific situations, like monitoring blood pressure during surgery, or maybe managing very severe hypertension in a critical care setting.
Right. So the focus in most cases is on the indirect methods then.
Exactly. Indirect, non-invasive blood pressure measurement is much more feasible in a typical clinic setting. The two main techniques we use are oscillometry and Doppler.
Oscillometry? How does that one work?
Oscillometric devices use a cuff placed around the limb or sometimes the tail. As the cuff inflates and then deflates, the machine detects the pulsations, the oscillations of the artery within the cuff. It then uses algorithms to estimate the systolic, diastolic, and mean blood pressure, and usually the heart rate too.
Okay, I think I've seen those machines. What about the Doppler technique?
The Doppler technique uses ultrasound waves to detect the flow of blood. So again, a cuff is placed usually above where we position a small ultrasound transducer,
Right.
typically over an artery on the front paw in dogs, or often maybe a hind limb or the tail base in cats. As we slowly deflate the cuff, we listen with the Doppler device for the point at which blood flow returns past the cuff. That sound returning gives us the systolic blood pressure.
And that's Mostly just for systolic.
Primarily, yes.
Hmm.
A significant advantage of Doppler, particularly in cats, is that it tends to provide very reliable systolic readings. It's generally considered better for systolic in cats than oscillometric sometimes, but it's not as accurate for figuring out diastolic and mean pressures.
So each technique has its pros and cons. Are there any crucial things to keep in mind to ensure we get accurate indirect measurements, whichever method is used?
Oh, absolutely. Proper technique is paramount. You won't get reliable results otherwise.
Like what?
Well, the size of the cuff is critical. It should be about 40% of the circumference of the limb in dogs,
40%.
and maybe 30–40% in cats, right at the spot where it's placed. The cuff also needs to be positioned at roughly the same level as the heart,
Why is the size so important?
because a cuff that's too small will tend to give you a falsely high reading, while one that's too large can give a falsely low reading. So you need the right fit.
Got it. What else?
It's also really important to take multiple readings, usually 5 to 7. And you typically discard the very first one because the animal might be a bit more tense initially.
Okay, toss the first, average the rest.
Kinda, yeah. And meticulous record keeping is essential. You need to note the specific technique used, the cuff size, which ling was used, time of day, any medications the animal's on, the animal's demeanor, were they calm, stressed, and who did the reading.
Lots of details.
Yeah. And finally, it's always crucial to interpret the readings in context. Consider the animal's stress level during the procedure, and definitely repeat the measurements if anything seems questionable or inconsistent.
That makes total sense. So if blood pressure stays elevated for a long time, what's actually happening at a microscopic level? What would a veterinary pathologist see in the affected tissues?
Pathologically, we see changes in the walls of the blood vessels themselves. There's often a thickening of the muscular layer of the small arteries that's called arteriolar hypertrophy,
Okay.
and also an increase in the number of smooth muscle cells in the middle layer of the vessel wall, known as tunica media hyperplasia.
So the vessels get thicker and stiffer.
Exactly. These changes lead to stiffer, less compliant blood vessels, which increases that systemic vascular resistance we talked about, and that further contributes to the high blood pressure. It's a bit of a vicious cycle. The elastic layer within the vessel can also get damaged, and this vascular damage happening throughout the body in the eyes, kidneys, heart, nervous system can result in things like hemorrhages, blood clots forming, swelling, and even cell death, necrosis, in those tissues. In the heart, because it has to work harder to pump blood against all that increased resistance, we often see the development of left ventricular hypertrophy. The muscle of the main pumping chamber thickens up.
So it's really putting a significant strain on the entire system. That brings us to treatment and management. Once hypertension is diagnosed, what's the main goal?
The ideal goal of treatment is to reduce the blood pressure to below 150 mmHg systolic and 100 mmHg diastolic. That's the ideal.
Okay.
However, sometimes a more immediately achievable target might be just getting the systolic pressure below 160 mmHg. Even that level of reduction can significantly decrease the risk of further target organ damage.
Right, reducing the risk is key.
Definitely. Treatment decisions are really based on the blood pressure readings themselves and also, crucially, any evidence of ongoing damage to those key organs we've discussed: the eyes, kidneys, brain, heart.
When is starting treatment definitely indicated? Like when do you say, okay, we absolutely need medication now?
Treatment is generally recommended in any dog or cat that consistently has a systolic blood pressure over 200 mmHg or a diastolic pressure over 120 mmHg. That's pretty severe.
Right.
And that's regardless of whether they are showing obvious clinical signs yet. Also, any animal with clear evidence of progressive target organ damage should be considered for antihypertensive therapy, even if their pressure isn't quite that high.
But what if it's just mildly elevated, no signs?
Yeah, mild, maybe transient elevations in blood pressure without any clinical signs might not require immediate medication. It's more of a watch and wait, monitor situation sometimes.
So it really depends on the individual animal and the whole clinical picture.
Exactly.
And is managing hypertension something that typically requires hospitalization?
No, in the vast majority of cases, hypertension management is done on an outpatient basis. Hospitalization might be needed if there's a really serious underlying condition requiring intensive treatment, like severe kidney failure needing IV fluids, or if there are severe complications directly from the hypertension itself, like acute neurological signs or a sudden retinal hemorrhage causing blindness.
What about lifestyle changes? Are there things pet owners can do at home to help manage their pet's blood pressure? Besides giving meds, obviously.
Generally, activity levels don't need to be restricted unless, sadly, the pet has experienced sudden blindness due to the hypertension. Then you need safety modifications.
Right.
Dietary management is a bit more nuanced. It might seem intuitive to restrict sodium, right? Salt restriction.
Yeah, makes sense.
But doing so can sometimes trigger other blood pressure regulating mechanisms, like that RAAS system we mentioned, which could potentially offset some of the benefit. So strict sodium restriction alone is unlikely to significantly lower blood pressure in most cases.
Huh, interesting.
However, avoiding very high sodium treats and foods is generally a good idea for overall health anyway. The most crucial thing really for pet owners to understand is that unless the underlying cause of the hypertension is something curable, like a thyroid tumor that can be surgically removed,
Right.
their pet will likely need to be on long-term medication to manage their blood pressure, probably for life.
Yeah, that's a big commitment.
It is. And owners need to be aware of the serious risks of uncontrolled hypertension and be really committed to giving the medication regularly, as prescribed, and coming in for those follow-up checks.
Long-term medication is definitely significant. Let's delve into those medications. What are the primary drugs used?
Okay, so first and foremost, the most crucial step is always try to identify and treat the underlying cause if possible.
Right, fix the root problem.
Exactly. But even as the underlying disease is well managed, the hypertension might persist, needing its own direct treatment.
Okay, so what are the go-to drugs?
For cats, the initial oral medication of choice is typically amlodipine. It's a type of drug called a dihydropyridine calcium channel blocker.
Amlodipine for cats.
Yeah, it's generally well tolerated and pretty effective in cats for lowering blood pressure. Now, if there's also evidence of protein in the urine, proteinuria, an ACE inhibitor might be added. That's for its potential renoprotective, kidney-protecting effects.
Okay, and for dogs, is it different?
Yes, often it is. In dogs, because proteinuria is a more common finding alongside hypertension, ACE inhibitors like enalapril or benazepril are often the first-line drugs.
AC inhibitors first for dogs.
Generally, yes.
Hmm.
These can also be beneficial if there's concurrent heart disease. Now, if the blood pressure isn't adequately controlled with just an ACE inhibitor, then amlodipine can be added to the treatment plan.
So maybe combination therapy?
Often, yes. And in some cases, if blood pressure stays high despite these initial meds, other drugs like spironolactone or maybe hydralazine might be considered.
And what about in emergency situations, like a hypertensive crisis? Are there faster-acting meds?
Yes, absolutely. In a crisis where blood pressure is dangerously high and causing acute symptoms, we might use injectable medications, things like hydralazine, sodium nitroprusside, or labetalol.
Injectables.
Yeah, but these require very careful administration, often as a constant drip, a constant rate infusion, and they absolutely need continuous direct blood pressure monitoring, usually in an ICU setting.
Right, definitely hospital territory. You mentioned different classes of drugs, calcium channel blockers, ACE inhibitors. Can you give us a quick overview of how some of these work, maybe some common examples and typical dosages?
Sure, let's break it down a bit. So dihydropyridine calcium channel blockers, like amlodipine,
The cat one.
right, they work by causing the blood vessels to relax and widen vasodilation. This reduces that peripheral vascular resistance and lowers blood pressure. Amlodipine has a relatively long half-life in dogs, around 30 hours, so it's typically given just once daily.
Okay. Dosages.
Typical dosages are roughly 0.1 to 0.5 milligrams per kilogram of body weight by mouth once a day for dogs. And for cats, it's usually a standard dose per cat, like 0.625 to 1.25 milligrams total per cat once a day.
Got it. What about ACE inhibitors? Enalapril, benazepril.
Okay, ACE inhibitors block the action of something called angiotensin II, which is a potent substance that constricts blood vessels, so blocking it leads to vasodilation. They also have beneficial effects on the kidneys, hence those renoprotective properties we mentioned.
Right, kidney protection.
Dosages. Enalapril is often dosed around 0.5 millikilograms by mouth twice a day in dogs, and maybe 0.25 to 0.5 milligrams twice a day in cats. Benazepril is typically 0.5 millikilograms by mouth, often just once a day. For both species, though sometimes twice.
Okay. Any others we should know?
Well, there are angiotensin receptor blockers, or ARBs, like telmisartan. They also block angiotensin II, but at a different point, they block it from binding to its receptors. Also causes vasodilation. For dogs, the usual dosage is around 1.0 millikilograms by mouth once daily. Telmisartan is actually licensed for proteinuria in cats, too.
Okay. ARBs.
Then you have direct-acting vasodilators, like hydralazine. They directly relax the smooth muscle and blood vessel walls. In dogs, a starting dose might be 0.5 millikilograms on mouth twice a day, which can be gradually increased. but we need to be cautious combining it with high doses of amlodipine.
Caution there.
Yeah. Alpha receptor antagonists like phenoxybenzamine are more commonly used in specific situations, like managing hypertension associated with that adrenal tumor, pheochromocytoma. Dosages are roughly 0.25 milligelligram Klebers twice a day in dogs, and maybe 2.5 milligram total per cat twice a day.
More specialized use then.
Generally, yes. Diuretics. Spironolactone, often used at 1 to 2 milligrams twice a day in both dogs and cats, primarily has anti-aldosterone effects. It helps limit fibrosis or scarring, which is good, but it's a pretty weak diuretic on its own.
And furosemide, Lasix.
Furosemide is a much more potent diuretic, but it's not routinely used just for managing hypertension itself, unless there's a specific need to reduce fluid overload, like in heart failure.
Okay. Last class.
Beta receptor antagonists, or beta blockers like propranolol and atenolol. They lower heart rate and cardiac output and can also suppress renin secretion. They are rarely used in dogs just for hypertension, unless maybe there's that pheochromocytoma again, or perhaps specific heart rhythm issues. Dosages vary quite a bit.
Wow, that's a lot of options. It sounds like tailoring the treatment is really key.
Absolutely. It often involves finding the right drug or combination of drugs for that specific patient.
Are there any situations where certain drugs should be avoided or used with particular caution, contraindications?
Yes, definitely. For instance, if a pet is on steroid medications or other drugs known to cause vasoconstriction, ideally those should be tapered off or discontinued if possible, as they can contribute to the hypertension.
Okay.
Arterial vasodilators, like amlodipine or hydralazine, can sometimes trigger a reflex increase in heart rate, tachycardia. And using rapidly acting drugs, especially injectables, or multiple vasodilators together, increases the risk of causing hypotension blood pressure dropping too low, which can sometimes lead to acute kidney injury. So careful titration is needed.
Right, don't want to overshoot.
Exactly. Beta blockers might not be suitable for animals with certain conditions like asthma, congestive heart failure, or specific types of heart rhythm problems. And high volumes of 5E fluids can also temporarily elevate blood pressure, something to watch in hospitalized patients.
What about drug interactions?
Yeah, need to be mindful there too. Combining certain meds can increase the risk of hypotension, as mentioned. And the combination of ACE inhibitors and spironolactone, particularly in animals with underlying kidney disease, needs monitoring because it can sometimes lead to an increase in potassium levels, hyperkalemia.
So careful monitoring is absolutely essential when managing hypertension. What kind of follow-up is typically recommended?
Regular blood pressure monitoring is paramount, absolutely key. Initially, this might need to be done weekly until the blood pressure is consistently within the target range.
Which was ideally
Below 150, 100 mmHg, or at least getting that systolic below 160 mmHg. Once stable, checks might be less frequent, maybe every few months.
Okay. And just blood pressure checks.
No, in addition to BP checks, regular lab tests are also important.
Yeah.
We need to monitor for potential side effects of the medications and also assess the response of any underlying conditions. So that might include checking urine protein levels, especially if proteinuria was an issue.
Right.
Kidney function markers like BUN and creatinine, and electrolyte levels like potassium.
So ongoing checks are part of the long-term management.
Definitely.
And what are some of the potential long-term complications if hypertension isn't managed effectively? What happens if it stays high?
Well, if left uncontrolled, hypertension can lead to a number of serious complications. Though maybe less common, congestive heart failure can develop from that heart muscle thickening and strain. It can definitely accelerate the progression of underlying kidney disease. It can cause further damage to the eyes, potentially leading to retinal detachment and permanent blindness. And it can even result in stroke-like events, cerebrovascular accident.
Neurological damage, too.
Yes. And one other interesting side effect, sometimes seen in dogs treated with amlodipine, is gingival hyperplasia. That's an overgrowth of the gum tissue. Needs monitoring.
So it's definitely a condition that needs to be taken very seriously. What's the overall expected course and prognosis for pets diagnosed with hypertension?
You know, the long-term outlook and prognosis really hinge on the underlying cause of the hypertension and how well that primary condition can be managed.
Makes sense.
In many cases, the high blood pressure itself can be effectively controlled with the right medication and consistent monitoring. However, it's important for owners to remember that while we can often manage the hypertension number, this doesn't always translate to a significant increase in overall lifespan, especially if there's a serious underlying condition like advanced chronic kidney disease already present.
That's a really important point to keep in mind. So, to recap, Systemic hypertension in dogs and cats is a significant health concern, often, maybe usually, indicating an underlying medical issue.
Hmm.
It presents with a variety of potential signs affecting the eyes, brain, kidneys, heart. It requires careful and accurate diagnosis, usually using non-invasive blood pressure measurement techniques done properly.
Right.
And it is manageable, often requiring long-term medication and ongoing monitoring, focusing on controlling the pressure and addressing the root cause if possible. You've truly helped us break down a lot of complex information today.
My pleasure. The goal was really to provide you with a solid understanding of the key aspects without getting totally bogged down in excessive technical details.
And I definitely think we've achieved that. It's truly fascinating, isn't it, to appreciate how interconnected all the different systems are within our pets' bodies.
It really is.
On that note, here's a final thought for you, our listeners, to ponder. Considering this wide range of underlying conditions that can contribute to hypertension, kidney disease, hormonal issues, and more, what other, maybe seemingly unrelated or subtle changes in our pets might actually be early indicators of deeper systemic issues that we need to pay closer attention to.
Good question.
It really highlights the importance of being observant and working closely with our veterinarians to ensure our furry companions stay as healthy as possible. Thanks for exploring this deep dive with us today.